Lola Abrahams is our sexual health and reproduction and well-being expert. Lola is a registered nurse, and she's going to talk to us on all things sexual health. But I'm going to start you off, Lola, by asking this. Now, is sexual health simply just the ability to enjoyably or successfully carry out sexual intercourse? Is that what the whole higgery-piggery is about sexual health, or is there more to it? And what are the common sexual health difficulties, if you like, or health complications that are more common to men and those that are more common to women? Just in a nutshell, and then I can expand on that. Lola, go ahead, you have the floor.
All right, thank you very much. Good afternoon, everyone. And I appreciate you, Femi, for this opportunity to be on this event this afternoon. Sexual health, like we all know, one of the things I probably want to start about what sexual health is and how people view sexual health. It's a practice, it's an activity, an emotional thing that we do as human beings, because we are sexual beings and we all have sex as adults or even as young people these days as it takes. And then people just feel that, oh, when I have sex and I enjoy it, then have a healthy sexual life. But I want to take a cue from WHO definition about what sexual health is. That sexual health is just a state of physical, mental, and emotional and social well-being, not just the absence of diseases or any form of dysfunction. So for us to have a healthy sexual life, or to say we are having sexual fulfillment, it takes a whole of our entire being. As humans, it involves our emotional, our physical, and our psychological mingling of the body and soul for the two parties that are involved. That because you don't have any form of diseases, or you are just a one-man partner or one-woman partner person, does not mean you are having a fulfilled sexual health. When you're having sex and you are not fulfilled or satisfied, that does not make your sexuality to be healthy. And there are some of the things that can be responsible for humans or for us as a sexual being not to be sexually fulfilled. There can be, like I said now, there can be issues of our orgasm or libido, or some difficulty, dysfunction. Like in men can have some sexual problems, that is erectile dysfunction. They can have premature ejaculation, which will not give satisfaction to the other party, or he himself can actually not be fulfilled, that is not actually attain what he needed to attain. And also for women, there can be painful sex. They can have pain during sex, penetratory sex, or they can probably not also have a loss of libido. One of the things we just need to understand is there are some limitations that can hinder our attainment and fulfillment of sexuality. And if these things are there, it is very difficult for us not to have a fulfilled sexual life. A woman can just be there and just say, okay, it's just an obligation, especially when it comes to marital people. They will just say, it's just an obligation, let me just do it and let him just get away. But she's not there fulfilled, because it's either she doesn't have orgasm, there is a loss of libido, there is a pain during sex, which can actually be medical, or it can be psychological. Like Dr. T has been saying, and what we're taking on here is about depression. Depression can be a reason why there is no sexual fulfillment. So a person that is depressed, that is not happy, that has so many things to contend with, is not just there to attain full sexuality. And one of the things I want us to take home here is, because the way we've all view sexuality as humans, we just think that it's a shameful thing and we can't talk about it. And inability to talk about these things limits our fulfillment and our satisfaction. Sexuality is meant to be enjoyed and not to be endured. It is meant to be discussed, especially amongst partners. we are in a sex-charged world where everything around us is sexuality is portrayed in everything that we see on the media, in relationship with people, amongst young people. There are so many vices of sexual health, so of sexuality. So if we don't talk about it, if we don't really look at it as something that we need to also take, and not just because I don't have diabetes or diabetes is more important than our sexual health, then we are not having this sort of wholeness we are talking about. Because for some people, they just think physical health problems is what they need to contend with now, and their sexual health is of less priority. But when diabetes is there, it can be an hindrance also to attainment of a good, healthy sexual life.
Thank you so much for that, Lola. And you've mentioned a couple of things there, which people might not realize. All right, if you by the end of this meeting, you'll see that everything is actually connected to mental health. So Dr. T has a greater portion of the cake today. Everything goes down to like Lola just mentioned now that even your enjoyment of or fulfillment in sex or sexual activity also is connected to your mental health as well. So of course, if you're depressed or you're down, of course, even if you're carrying out the act, that doesn't necessarily mean you're enjoying the act. Now, while I was doing some reading up, this is for Lola, while I was doing some reading up on this, being a man, of course, my eye was drawn to a statistic that quite honestly scared me. And that's what you just mentioned now about erectile dysfunction or ED. Now, I know that as a man, if I were to experience that, I'm certainly not going to have that talk with my men on my men's group. I'm not going to call guys, guess what? You know, it's just not something men do. We should be able to, but we just don't, because I think that our masculinity has been taught to us that it's actually between our legs, and it really isn't. So it's sort of like, if you're having that disease, then you can't talk about it, because that's your manhood that's been taken away. But another statistic from NICE, which is the National Institute for Health and Care Excellence, which Lola will be very familiar with, says that by the year 2025, 322 million men will suffer from this. Now, like I said, that was very scary. There are closer statistics that actually say 1 in every 5 men will experience this. It talks about men over the age of 50, but it's certainly not peculiar to just older men. Younger men can have erectile dysfunction. Please, Lola, tell us, what is ED, erectile dysfunction? How does it limit our ability to have sex as men? And what is out there? Is it herbal only? Because some people will say, back home in Nigeria, that those days will say, I will, go and get the leaf, go and get that leaf, go and get that leaf. Before you know it, you've deforested the whole neighborhood, just trying to make some kind of potion. Or are there herbal remedies to it? Or is it just all has to be tablets and pills? Lola, please go ahead.
Thank you very much. Yeah, like you just said, it's a very difficult thing for most men to even come out and say they are having this challenge. But what is erectile dysfunction, or ED, as it's popularly called? This is when a man cannot get or cannot keep erection. Normally, for a sexual act to come on, the man needs just to be up there and fully erect to have his sexuality fulfilled. So when he cannot even get any, or he cannot, or he gets and it quickly drops, then that is a dysfunction of his erection. So, and this can happen to men at any time in their lives. It can come up either early, mid, or which can be attributed to so many things. It can be physical or psychological. Like I said earlier, if you don't have a balanced mental health, your state of mind is not there. It affects your erection as a man. It can be work issue. It can be some social problems. We're talking about COVID now. A man that has lost his job, one of the last things that can probably come to him regularly is having sex. So
Lola, well, we can argue that one, because you might say he's lost his job, all he has got left is sex. So it can work. Because also, just to throw in a spin, the childbirth rate has gone up during COVID. They're now called COVID babies. So, people are recommending people to buy TVs. So it works both ways. Because he has lost his job, doesn't necessarily follow, you see.
But then it depends on who he is and what his commitments and responsibilities are. Because of COVID, we have high rates of domestic violence as well.
That's
so
true.
Which can also, like I said, there can be a lot of things that are responsible for that. It can be physical, it can be psychological. For somebody that is physical, it might be physical health, which can be cardiovascular problem or diabetes or anything. And medication. And if somebody has got these health conditions and it is on long medication, the effects of the medication it's using can also affect his erection. So there can be a lot of things that can be responsible. There can be alcohol, people that are on alcohol. There can be smoking. There can be people that the use of illegal drugs, and so many things can be accountable for this. So it depends on the state of mind. And that's why I said sex and sexuality, or health of sex, has to do with physical, mental, and emotional mingling. So all those things put together will make somebody to have a good sexual life. So with erectile dysfunction, there are so many treatments out there. Medically, there are treatments. People get Viagra to help them to boost their erection. And that's why I said, if anybody is having these challenges, it's not just good enough for you to be quiet. See your doctor, go to your GP, be open with it. There is nothing to be ashamed of. But one of the challenges we have is people are very ashamed of it. And instead of actually talking it out also with your partner, you tend to shy away from it. It does not work, and it will not make you to attain whatever you want to be. Traditionally, there are also herbs for us that are from back home, Nigeria, and from other African countries. There are also traditional things that people use, and they use so many herbs, and which works for them. But there are all these medications and treatments out there to actually correct this, and then a man can have his erection as that's when needed.
Thank you, Lola. Let me just pause you there. I've got a question from Dr. A. Doctor, please go ahead.
Thank you. I actually don't have a question, just a little contribution, because like Sister Lola said, it can be really embarrassing for men to go to their doctor to talk about erectile dysfunction issues. And I just have a few tips to help men. So usually when you call your GP surgery, sometimes they'll ask you, what's the reason for your visit? You don't want to be telling the receptionist it's because I can't get it up. So you may want to say things like, it is personal, or I choose not to say. Another thing is, some of us have, at least in my part of the world, African part of the world, men may find it more embarrassing to discuss this with a female doctor. So if your primary doctor is a female and you feel more comfortable talking about this issue with a male, I think it would be okay and prudent to say, may I see Dr. ABC or Dr. Joe, who is male? He's not my regular GP, but is it okay if I just have this discussion with him? So let's assume you've crossed the first hoop. You've been able to get an appointment to discuss something that's personal with Dr. Joe, who is male. You're now in the room with Dr. Joe, and Dr. Joe says, oh, so hello, Mr. XYZ, how can I help you? It's sometimes difficult, and I'm also saying this from experience, for patients to say, you know what, I can't get it up. No, you may say, I'm having some problems in the bedroom. And most doctors would take that as a cue and ask you, what sort of problems are you having in the bedroom? And that can just kind of really encourage the patient to open up. So don't always feel it's an impossibility to talk about. There are ways you can jump the loop. There are ways you can get into the room with the gender of doctor that you're more comfortable with. And there's simple ways that you can actually say this. The second thing I was going to talk about is that the penis is a very vital organ, just like the heart, just like the kidneys, just like the brain. So usually people get heart attacks, they get strokes from what we call cardiovascular issues, because the penis is also an organ that is vascular, which means it has its own blood supply. Sometimes the first sign of a cardiovascular disease, which could cause a heart attack, which could cause a stroke later in life, may be erectile dysfunction. So please, it's not something we should, shove aside and say we're not going to talk about it. Yes, as Sister Lola said, there's psychological reasons, medication, so many other things, but it could actually also be a warning sign for a heart attack in the making or a stroke in the making. So please talk to your doctor. Thank you.
Dr. T, while I've got you here,
Yeah.
there is supposed to be a connection between regular healthy sex and mental health. So of course I'm not going to pretend I know what the chemicals are, but there's supposed to be certain chemicals that are good for mental health that are released when intercourse is taking place. I'm not saying that's the only way, so that you don't think instead of going to the gym, this is the only way. But there are certain things that will help you, that actually a healthy sex life actually help with mental health as well. Am I correct in saying that?
Absolutely. I mean, like Lola was saying, if healthy sex is part of good overall health, is part of good physical, mental, and psychological health. Good sex, healthy sex is a feel-good process. It releases a lot of endorphins. It releases a lot of happy, feel-good hormones. So definitely it would help your mental health. It's not the only thing, but a sexless marriage, a sexless relationship can't have joy. It's that, and that's why some people will step out of their usual relationship just because they're not getting that satisfaction in it. So I do believe that good sex is part of a good life and good health, just
Thank
like
you very
Lola
much.
said. Thank you.
Thank you very much for that. Lola, I'm coming right back to you. Just bear with me a second. Pastor Rufus, you had something to contribute?
It's all right. I think Dr. T has actually said what I wanted to say, that just to encourage the men not to be embarrassed in talking to their doctors. I know many people will not be able to come to their pastors to say, this is what I'm going through. But at least the doctors will be able to keep the confidentiality. And it didn't happen here. I think I've counseled some people when they came to me, not even in the United Kingdom, so nobody will know. And the first thing I just asked the couple, when was the last time you people had sex? They said 6 months ago, and they were going through divorce. And God just put that in my mind. And I think about 6 months or maybe a year later, I had a couple. I just said, let me just ask the same question. And I asked the same question, and they said for the past 1 year, the man has just used my home as the hotel. He will just go out and nothing has happened for 1 year. So I think a sexless relationship, I think, is heading for a separation.
Yeah. Just to add on to that also, I think a sexless relationship is mainly the outward manifestation of what has been brewing underneath. It's not, because if the relationship is harmonious and enjoyable in the first place, then the sex automatically comes as usual, doesn't it? Well, I suppose that's one for our family first fellowship discussions. Now, Lola, let me come back to you. Now, of course, we've looked at that for the men, but there's also the condition where women struggle to have penetrative sex. And while we have this pre-meeting discussion, Dr. T was able to differentiate for us the difference between enjoyable sex and penetrative sex, that not all sex has to be penetrative. Now, I want you to enlighten us on certain conditions, because as a man, you might find that your wife sort of rebuffs you or nullifies your advances because she might find it uncomfortable. And you might say to yourself, well, we've been married 5 years. Why are you suddenly uncomfortable? Is that your way of saying, you don't want me there anymore? Am I not attractive anymore? And that kind of statement from the wife can be misunderstood as rejection. So what are the situations, and how common is this for women, that they actually find penetrative sex difficult?
Well, penetrative sex, first, let me take it from painful. What's penetrative? What kind of sex can a woman enjoy or not? That is it always penetrative? Penetrative sex is for the woman to reach orgasm or enjoy sex. It doesn't necessarily have to be penetrative. There are different ways. Comes to the foreplay, the romances, the touches, and all the romances, which for different people it works differently. And most women can actually be satisfied without having penetrative sex. And what is penetrative sex? That is when the penis is also just inserted into the vagina. And for most women, it might not be it. They might find it painful. Why will they find it painful? Some of them can just have a spasm which is also a dysfunction in women. It can be, this is the spasm in the vagina that can cause pain. And for some, it's psychological, that they just think, oh, sex is just painful and I just don't want it. And for women, a lot of color, like us too, they just believe, oh, I'm not just in the mood for this, probably due to tiredness or one thing or the other. But largely, it might just be because she's not just satisfied. She's not reaching orgasm. There is a loss of libido for the woman. So one of the things that could cause this is the impatience of the man from his own part, because if he's coming making advances at the woman and the woman just rebuffs him and says, please just leave me, you don't understand what she's going through, you don't understand what she feels like. She's not having orgasm, she's not just enjoying what this can be. So why will I just want you to be coming every now and then? It's not just all about the man, because she's not having, there is no sex drive, there is a lack of orgasm. So what are we talking about? She's not just interested in it. Another thing that can cause painful sex for the woman is the woman at the age of the menopausal women, there is dryness. And if a woman is not, because what is the cause of this menopause? Because there is no more estrogen that is being released. So she's always feeling dry, she's not wet. So that can cause pain. But if the partner does not understand that these are some of the issues, then she's just going to be avoiding sex all the time. And another thing is, a woman, when she's not well stimulated, she's not emotionally ready, then she can find sex painful. So with all these, it needs to, and that's why I said to me, sex requires a lot of communication with two partners, because we need to know what the other person feel like, and we need to know what turns you on and how you are really there and you're satisfied before we go on. But some men are just probably just impatient and they just want to get there, especially when they have the erection, they just want to go there. So because if all those things are happening for the women, she's not stimulated, she's not enjoying sex, then she will not want another attempt when you come the next time.
Okay.
And for some women too, for African women, they probably have had FGM, female genital mutilation, or cutting. So that has actually also reduced their libido. They don't even have, for instance, depending on the type of female genital mutilation they had, it can be a chop off of the clitoris, which is actually where the sensation mostly is for women. So a woman without that will not even just feel aroused, talk less of even getting orgasm. Or if she's had another type that has been really, really mutilated, she will actually be experiencing a whole lot of pain. So with that, she will not just be interested in sex.
Thank you very much, Lola. I've got a question from Pastor Rufus, which I'm going to take in a minute. But I wanted to ask you, it's communication is golden, especially in when you're in a relationship, a sexual relationship, where if one person is struggling with something, that you can talk to each other, and so that the other party, who apparently doesn't have a problem, can understand what the other person is going through. But I want to ask you, are there particular clinics that you can go to instead of just going to a general practitioner? Are there counseling clinics you can go through? How do you access services for things like this? Because if a woman is suffering with dryness and all these things, is the GP the only place she has to go, especially if it's one of an emotional nature or a psychological nature? Where would you go to? Do you go to a psychiatrist? Do you go to what do you go?
Yeah, it's not only the GP. In fact, there is exclusive sexual health clinic. That is the genitourinary medicine clinic. And in this clinic, you can access diverse services.
Sorry, can you take that slowly and repeat it for us again so that we can hear that?
There is let me just call it sexual health clinic. In United Kingdom, it is called sexual health clinic, or the GU, genitourinary medicine. Right. So, but popularly it's called sexual health clinic. There are psychosexual therapists that can actually walk the way through with you. And for instance, for a woman that is a menopausal woman, there are lubrications that can be used that can help this. For whosoever, a woman that is having spasm or painful sexual, there are tapes and there are medical equipment that can be used to help to dilate. In the sexual health clinic, they can give you the help there, or the psychosexual therapist. And with this, they can talk you through. A woman can express what it is. But largely, especially for we people of culture, I think the communication, the sexuality education is actually missing for a whole lot of people. How was our sexuality taught? How do we even know how or what to expect in sex, or when you're in a relationship? We have learned through different ways. We've learned through peers. We've learned through the media. We've probably learned through school, if there was one. And some can say, okay, we learned through church. But how detailed are these things? And then in the communication with your partners, have you been able to possibly identify your sexual expectations? Because if you know what to expect from your partner, and the partner also know what to expect from you, it will largely help in dealing with some of those problems. But like the focus of what we're talking about now, there are health professionals in the sexual health clinic that can help, and there are psychosexual therapists that can provide you with assistance. But for some people, it is just about the knowledge they've had and which they carried into their relationship. And that, oh, I'm not supposed to discuss this, or I'm probably not expected to enjoy it, or I'm just only there to fulfill the man's sexuality. So what about you as a woman? It is very important for a woman to be sexually satisfied and fulfilled, just as it is for the men, so also it is for the women. We are not just there to just oblige to the man. It's the win-win thing, and it's for both of us. So if a woman is not reaching or achieving her sexual desires met, then it is worth discussing. And that's why communication is very key. But for cultural people, they might think, oh, where is that coming from? But I think at this age and time, it's better we do away with that and learn more and seek counsel and ask people questions on how to go about this.
Well, thank you very much. I like what you said about the satisfying. Of course, you know, we had a talk some time back during Valentine's Day about sexual appetites. There must also be agreement, isn't there? Because if one person can be there all night and one cannot, then already there's a mismatch. So
there is.
That discussion needs to take place, and it might not be because of lack of ability. It might just be quantity. So that discussion definitely needs to take place, and it's one we need to be doing with our partners. Lola, I'm going to come back to you for one bombshell of a question, and I just want you to enlighten us on that. And that is how active our youths, when I say our youths, even the children in our own homes, who are by law underage, are sexually active, and how we as parents might want to tackle that, and things to look out for our kids. Because as you know, you've got extensive experience in sexual health clinics, and of course, without giving anything away, without mentioning any names, you see especially all kinds of ages of minors coming in who are sexually active. So I'd just like you to shed a bit of light for us on that. But before I do that, my wife has a question. Babe, go ahead. You're muted.
I thank you, babe. So this is just, I think, based on the discussion we've had from Dr. T, Pastor Rufus, and Lola. And I'm thinking, Dr. T said you can choose your doctor, gender-wise, where you're comfortable to talk about issues. And I'm thinking from a woman's perspective. And for we who are Christians, we're in church, maybe you have this issue and you're thinking, do I go to my pastor? So if your pastor is a male and you're a female, that's already a barrier there. And then you're thinking your GP is a male. Now, on the side of the women, we have, like, for example, the smear tests. You have to go to and see your gynecologist and do whatever. It's very, very uncomfortable, let alone finding that your gynecologist is a male. You understand? And I think these are some of the things I'd like more light to be shed, especially within the church, because I find a lot of us, we hide in the church, and then we're burning with issues there. And then we're thinking, how do I go? My GP is a male, he's this. How do I go and, start presenting myself for him to talk about this kind of things or to check me, So rather than going to deal with the issue in the early stages and maybe get treatment and be well, I hold on to it. So it's something within me I can't talk about freely because I don't have that community. I don't have that avenue where I can feel supported. And then the GAM clinics that Lola talks about, it's most of the time, I know adults go there, but most of the time it's the teenagers using them. So imagine you're a mom and you're going to the GAM clinic, you meet your teenage friends, your teenage sons or daughters' friend popping in there. You understand? So I think as we are growing older, there's that stigma within our communities of church. And then there's that, I don't know what to call it, where you feel like, I can't speak to my doctor. If she was female, maybe. If my pastor was female, maybe. But at the same time, our culture is such that we have not been raised to speak about these things freely. So you start to think, if I speak to this sister, oh my God, I wonder if she'll carry my business and take it out there and share it. You understand? So how do we address this?
Thank you very much, Hannah. Are you happy for me to take that?
Yes, go ahead, Lola.
Yeah.
Yes.
Oh, well, this is one of the challenges that we have in the faith, in our community as African people. Like I said earlier, we are in a sex-charged world. Sexuality is poking at us everywhere. Yet it is what we actually find difficult to discuss most. Why? Naturally, sexuality has been attached with shame. And when you want to talk about it, people look at it as, oh, you're probably using vulgar words. It has its own stigma that is attached to it. But for us to actually do this, there is something that I've come out and which I've discovered, that sexuality needs to be demystified. It has this ugly veil that has covered it so much that nobody wants to talk about it in church, within the community, amongst peers. People find it difficult to talk about. And for us to attain all these fulfillment and satisfaction, for the so many issues, the complications that comes as a result, that emerges as a result of sex and sexuality, the only solution to it, I'm sorry, that I know and which I have seen proven and tested, is talking about it. Keep talking about it. The more we talk about it in the church, the better it becomes. The more people see it as the way we talk, as like we talk about diabetes, the way we talk about any heart or hypertension. We need to get there, especially for our community. In this Caucasian world where we are, in Western world, to them sexuality matters. Fine, it also has its own shame, but it is not as bad as it is deeply seated with us. So talking about sex and sexuality is very, very key in today's world. One of the things you just said about now is the smear test, for instance, that you talked about. So many ladies, women still refuse to go for smear test, which is to just screen you for cervical cancers. Some would not just want them to be opened up. And like Dr. T said, you can ask for your choice of gender of doctor, your gynecologist or your GP. If you are a man and you want a woman, if your GP is a man and you want a woman, you can actually ask for that. And if you don't feel comfortable with your GP, the GU clinic, that is a sexual health clinic, also does smear test. So you can do that. And with every kind of sexuality problems we have, we can easily access this in sexual health clinic. Like Han said, how will I even do this? I know it is attached with stigma, but until we talk about it, until we deface it, we cannot remove the stigma. I did conducted a research about women between the age of 40 and above, and to know the prevalence rate or the accessibility that they have, how much do they access the sexual health services. And not only in our Black community, even for everybody, even for the Caucasian, all the women find it difficult to access sexual health clinic. Why? Because of the stigma. Why? Because they think it's only for young people. Yes, you will see young people there. They are very active. They are very vibrant. And the services are there for them because so many government interventions or program interventions is mainly targeted at young people. And we just believe that, oh, it's only young people. And it's not also the fault of the older ones. And I think it's program designs and interventions, because they believe that, oh, older people are probably not, or they are aware enough, or they know what to do. Okay. Meanwhile, they are also suffering with this, and they have the stigma and the reluctance to walk into sexual health clinic, but they think somebody somewhere there might know them.
Okay, great, Lola. But Pastor Rufus, thank you very much for that, Lola. And thank you, babe, for the question as well. Pastor Rufus, please, you had a question for us, or a contribution, I think it was. Was it yourself? No? Okay, great. Right. Now, Lola, very briefly, please, I wanted us to touch, of course, we had our own meetings before this meeting, and we talked about this, and it was a bit of a concern for the parents as well. Now, like I've mentioned, I've told you already what we brought up about the youth, the age of sexually active children. And when we say children, we tend to look outside. If you have youth in your house, then potentially we could be discussing something that is going on in your home now. So what are we looking for? And should we be sitting our children down, even if they're underage and we know that they're active? Should we be sitting them down? But you see, as African people as well, or as African people of a certain age, of an older generation, if you like, or of a certain upbringing, we find such discussions very difficult. You know, our starting point is it shouldn't be happening at all. Well, the fact is, it is. You know, so get over it. It's happening.
That's it.
You know,
That's it.
So what do we do? What are the things that we're seeing, or what are the things that you are seeing as a professional, and how do we approach this matter in the house? Please make it as brief as you can. Thank you.
Yes, thank you very much. If we, as parents, if you're still living with the ignorance that, oh, my children are not doing it, or young people are not supposed to do it, especially if you think we are people of faith, I'm sorry to shock us that young people are very, very sexually active. And in this environment, you will see young people as young as 12, 13 in the clinic coming to access sexual health services. So one of the things is, and when I said we just need to keep talking about it to reduce this stigma and this ignorance, it is important. It's a very good topic for us to talk with our children. And we can start as early as age 4, 3, 4, just to give an age-appropriate information. The more we give our young people the information, the more they are able to make informed choices and decisions. In the clinic, we've seen a lot, and some of them actually come in with total ignorance of the consequences of their actions. Legally, in this country, 16 years is the age of that young people can consent and they can give out sex. But for us, as people of faith and of culture, we say no, 16 is too young, or it's not supposed to be done premaritally. So the only thing for us to prevent this is to keep talking to our young people. Parents can actually feel fragile and say, oh, how do I say it? I know it's a lot of weight on cultured parents of African people, though I can't even talk about it. What do I say? But I can assure you that there are materials out there that can help parents. There is a book that I used to have then that said, can we really talk about it? So what do you want to talk about? It can just be part of one of your gists with children. You talk to them and you discuss all this things with them. Just start at, like I said, age appropriate, and test their knowledge. If you don't know what to do, test their knowledge of what they know. Because they also do these courses in school, in high school. So they talk to them in secondary school. They do well-being and all that. So talk to them about what do they know. Or probably you talk about their growth, about their body changes for girls, and even for boys, they're breaking of voice, all those signs. And you're already talking about sexuality with them. So in the clinic, they are there, and they do come because there are lots of services available for them. So many parents are ignorant that even their girl child in the house is pregnant and she's gone to the clinic to get abortion. And because of the ethics of the profession, they are obliged to avail them the confidentiality, and they will reassure them that your mom does not need to know, your dad does not need to know. Yet this young girl has gone out there. She's just going out like she's going out with friends or to school. She's gone to the clinic, done the medical abortion, and she's back home and nothing is wrong with her. And yes, you don't know what is happening. So it is very important. I would advise parents, please be close to your words. Talk to them, be part of their lives. Don't be ignorant that you don't know what is happening out there in the clinic. there is sexual health clinic and the loads happening there. They give them contraceptives, they give them condoms, they give them pills, they do abortion and all sorts. And they practice all manner of sex. So there are so many things happening out there. So it is very important for us as African people to look into our society, know the service that is obtainable there, and investigate. Walk in there, it does not bite. It doesn't bite. Just walk in there and know what is obtainable.